Most mistakes in situational judgment come from prioritizing the wrong value, like confidentiality over safety or respect over autonomy. My name's Farhan, I'm a junior doctor and I've helped over 100 students get into medicine and dentistry across Australia. And in this video, I want to tell you everything I know about situational judgment, where you're able to recognize the following core principles. So the main framework that I really want to run you through today is the SAS priority ladder. That is safety, autonomy, and standards. Essentially, in this ladder, safety and autonomy are in a league of their own. They're the most important things when it comes to situational judgment questions. And then below that are the following standards, which we'll go through one by one. What I want to go through is just a couple of tips per each principle, the things to think about, and then we'll drill it home with a practice set of questions per principle as well. So let's start off with safety. Number one, the most important thing to think about is safety of the patient. Any action that compromises the safety of the patient is certainly going to be inappropriate. I think that just goes without saying. The safety of your colleagues is also important. Ensure that your colleagues are going to be safe and able to put their best work into what they're doing. This kind of goes hand in hand with the safety of the patients, because a colleague that is unsafe at work, for example, if they're shown up drunk or drug affected to work, then that's going to have a significant impact on their ability to give proper patient care, which compromises the safety of the patient. And lastly is safety of yourself. Overworking yourself can actually be a real issue. It's okay to say no to extra responsibility. Look, in medicine, there is no gold medals for people that are able to work tirelessly. And the world of medicine is actually very acknowledging of burnout as a factor. So safety of yourself is important, and these situational judgment questions don't expect you to put yourself at risk in order to take on these opportunities. An exhausted doctor means poorer medical decisions, which means poorer quality of patient care, which again just goes to show why the safety of the patient is the most important quality. Now, before we get into a practice question to drive that home, I quickly just want to go through what each of these answer options means. There are two types of questions in situational judgment: importance questions and appropriateness questions. So here's what these all mean. If something is very important, it's a key factor to consider in choosing your approach. If it's important, it matters. It might even influence how you go about your approach, but it doesn't influence the core decision. Of minor importance is something that you can't just completely disregard. You have to think about it at some point, whether it be after the situation is dealt with. And D, not important at all, just means that you should not be regarding this at all. In fact, regarding this factor in making your decision could actually lead you to make the wrong decision. And if we just skip ahead to an appropriateness question, let's go through every single one of these. If something is very appropriate, then it's great. There's no drawback to whatever you're doing there, and it is absolutely the right thing to be doing in that position. If it's appropriate but not ideal, it's you trying to do the right thing. It's probably one of the better courses of action, but there is some sort of a drawback that a very appropriate response otherwise could deal with. If it's inappropriate but not awful, it's something that you shouldn't be doing, but it does slightly go out of its way to mitigate harm in some way or another. And D, if it's very inappropriate, it's just something flat out that you should not do. Now, in terms of how situational judgment is marked, let's just say the answer here is B. And if you select B, then you've got the correct answer. You're going to get 1 out of 1 mark. Whereas if you pick something like A, you're going to get some partial mark. So the exact partial mark that you get, we don't know, but you get some partial mark. And if you pick C, on the other hand, you'll also get a partial mark, but you'll get a reduced one. The reason being is I want you to imagine it almost being split up into 2 sections, A and B and C and D. And if you're on the more correct side of the answer, in this case, as A is, then you'll get more partial marks. Whereas if you're on the incorrect side and you're 1 step away, then you'll get less partial marks. If you pick D, then you'll get no marks whatsoever because you're more than 1 step away from the correct answer. So with that said, let's get back to our initial question. So feel free to pause the video here, have a read of the stem, go through the question, and then we'll run through it together. So how important is the potential harm that continued medication overdose could cause to the patient? Is very important because overdoses pose direct risk of serious harm. And because patient safety is probably the most important factor to consider in all of the principles, that's why this is very important. Doesn't say anything about the medication here, but there are some medications out there which are very, very, very dose specific. And if you give any more than what you should, that can get very toxic very quickly. That's why it's very important. Number 2, that Dr. Patel is unfamiliar with this particular pump model. Well, this one is important. It's important because if you're not familiar with the pump model, you can't really do much about this. It doesn't change the core decision that you take. At the end of the day, what you're doing is stopping the pump and trying to do something about the situation. But if you're unfamiliar with it, you can't do it. So it just might change the course of action that Dr. Patel takes in terms of the fact that it might not be Dr. Patel turning off the pump, it might be somebody else. And that's why Dr. Patel might reach out for help instead. How important is it whether experienced nurses or senior staff are available to assist? This one is important. Again, the staff availability here shows who Dr. Patel should approach to help. It doesn't change the fundamental action, which again is to do something about this situation, turn it off, or get somebody to help you turn it off. It's important because it changes the way you go about that. And lastly, that the nurse responsible for the patient is currently dealing with an emergency. This one is actually important because knowing that this nurse is unavailable means that Dr. Patel must seek an alternative person to help them with that particular situation. Because in the hospital, every patient typically has a nurse assigned to them, and you'd rather let that one nurse know about everything going on with this patient so that they're on top of everything. But if they're at an emergency, then it doesn't change the fact you still need to do something about this. The reason this is important is because it tells Dr. Patel they need to reach out to another nurse or the head nurse to do something about this. Great. So now that brings us to our principle number 2, which is autonomy. Autonomy is all about giving patients the choice. It means giving them the ultimate say in their treatment. And the only way that they can have the ultimate say is if they actually understand what is going on. A doctor's role is to inform the patient about the treatment that they're recommending. It's to go through the pros and all of the cons and suggest courses of action. And it stops there. Because if the patient is capable, then you cannot make a decision on behalf of the patient. I don't think situational judgment will ever put you through a case where a patient is not capable. They teach you a lot about that stuff during medical school. But as far as SJT goes, it really is just about giving complete choice of treatment to the patient. Now, when it comes to autonomy and consent, the most important thing to remember is VIC. That is, in order to make a sound decision from a patient's point of view, it needs to be voluntary, it needs to be informed, and you need to be capable. You can't be coerced into it, otherwise it's involuntary. You can't make the decision without having all of the information in a language you understand, in a manner you understand. And you can't make a decision if you're not in a mentally sound space. For example, if you've got advanced dementia or if you're having a manic episode. Again, things that SJT and the UCAT probably won't test, but if you're going to end up sitting the interviews later on this year, then things to think about. So let's go through a question. Feel free to pause the video here and have a go at this question. So, how appropriate is it to accept the son's offer to translate and proceed with consent? So this one is actually very inappropriate because family translation, it risks a lot of misunderstanding, bias, or omission of important information. Valid consent, especially from a legal point of view, requires professional interpretation to ensure a genuine level of understanding. So always get a professional interpreter. Number 2, how appropriate is it to wait for the professional interpreter to arrive before taking consent? Well, given what we've just said, this one would be very appropriate. Number 3, how appropriate is it to use simple English and hand gestures to explain the procedure yourself? Now, you might think that this is at least trying to do something, but remember, the patient needs to know what is going to happen, especially before a surgical procedure. So this is still very inappropriate. They need a professional translator. And how appropriate is it to reschedule the procedure for when interpretation services can be properly arranged? So this one would be appropriate, but not ideal. because rescheduling ensures proper consent, but it delays treatment. So in a case like this, it would be better just to wait for the professional interpreter to arrive, for the consent process to go through, and then for the minor surgical procedure to happen. All right. So that brings us to the standards section of the SAS priority ladder. So we're going to go through these one by one. I wouldn't really put one above the other. As you'll see in a lot of these cases, sometimes professionalism is the most important. Sometimes boundaries is the most important. It all depends on the context of the STEM that you're given. So that said, let's go through beneficence and non-maleficence. So clearly defined, beneficence is all about doing good to patients, and non-maleficence is about not doing harm to patients. Now, it's important because any medical decision regarding treatment should be made with the intention to improve patient health as much as possible, but also to minimize potential harm to patients as much as possible. You might think that this is super obvious, but there are some cases, like a life-saving invasive heart surgery, which, if you think about it, causes a lot of short-term harm to a patient's body. The loss of blood, the risk of infection, etc. But in a case like this, the beneficence of being able to potentially save this person's life overrules the non-maleficence here. All right, so let's go through a practice situation here. Feel free to read this scenario and then we'll go through it together. So, how appropriate would it be to prescribe the antibiotics to maintain a good relationship with the patient? So this would be very inappropriate because you're prescribing medication that's ineffective here, and antibiotics don't come without their harms. They've got a lot of side effects, a lot of upset tummies, even allergic reactions, and giving that without benefit would just be negligent, right? So good relationships here should not compromise the evidence-based practice of not giving antibiotics for a minor viral cold. Now, how appropriate would it be to explain why antibiotics are harmful in this case and offer supportive treatment advice? So this would be very appropriate because you're giving education, you're helping the patient get smarter, and you're telling them why prescribing antibiotics in this case would actually be of harm and not of. How appropriate would it be to prescribe antibiotics but advise the patient only to take them if symptoms worsen? Now, this one here would actually still be very inappropriate because it still provides unnecessary medication and encourages self-diagnosis. At the end of the day, the patients come to you to help with the diagnosis. If you're just going to tell them, look, if things worsen, then you've got bacterial, then take the antibiotic, then you're encouraging them to self-diagnose themselves. It fails both beneficence because it doesn't help and non-maleficence because now it risks harm. So that's still very inappropriate. And lastly, how appropriate is it to offer a follow-up appointment to reassess if symptoms don't improve? This is a very appropriate thing to do because now it allows you to give that safety net for rare complications whilst avoiding unnecessary treatment. This is the kind of safety net that you want. A lot of people might think that prescribing the antibiotics is the safety net, but the real kind of safety net you want is to just reassess them to see if things have worsened so that you can use your own clinical judgment to determine if they need the antibiotics here. All right, so that brings us to boundaries. So there is a couple of boundaries to be aware of. Number one is understanding your roles. You can only do as much as you are capable of. And so, if you're a second-year medical student, you should not be doing the same things, the same roles as the main orthopedic surgeon. I think that goes without saying. You just don't have the knowledge or the competency to be able to do that. There's professional versus personal boundaries. In medicine, you keep these two lives separate. There are no close connections with patients outside of healthcare, and there's certainly no treating friends and family. The reason is because if you're treating someone that you have a close connection with, then your judgment is clouded by the connection that you have with that person. You can't really make an objective decision on what to do in that case. And lastly is neutrality. Look, at the end of the day, everybody is entitled to their own political, religious, and ideological beliefs, but you can't enforce or impose these opinions on patients and colleagues. So let's go through an example of boundaries. Have a read of the question and let's go through it together. All right, so how appropriate is it to attempt the lumbar puncture independently to gain experience? So guys, think about patient safety. This is why the SAS letter exists, because safety and autonomy are paramount. This one is very inappropriate. Performing procedures beyond your competency is risking patient harm. So the lack of supervision makes this entirely inappropriate. How appropriate would it be to decline the task and explain that you require supervision for this procedure? This one is very appropriate. You're recognizing your limitations and boundaries, and you're requesting supervision so that you can still do it, but with the appropriate level of guidance. How appropriate would it be to ask a senior colleague to perform or supervise the procedure? This one would be very appropriate because you're seeking professional help in a case like this. Now, I want to change this question just slightly to just this. Ask a senior colleague to perform the procedure. And I want you to think what the answer to this would be. So had it said, ask a senior colleague to just perform the procedure, I think the answer to that would be appropriate, but not ideal. It's appropriate because the senior colleague has all the experience to be able to do the lumbar puncture, but a lot of medicine is about making the most of learning opportunities. We'll see that in the professionalism category. So if there's an opportunity for you to do something, it's preferred for you to at least have a go at the procedure whilst having the appropriate level of supervision. All right. And that brings us to our third standard here, which is integrity. So when it comes to integrity, you think about honesty. It's really simple. Be honest. Do not lie. There is no room for lies, even white lies. When there are errors, and errors will inevitably be made, we are all human, we all make mistakes, then owning up to these mistakes is a crucial part of improvement as a doctor, but also as a person. And when it comes to using resources, as a medical professional, you will have access to resources. This is a position of immense power, so please do not abuse it. You have no right to take equipment or to take medication unless you are a patient yourself, in which case you don't take shortcuts. You go through the process of being a patient yourself and go seeing another doctor and having them diagnose and prescribe you instead of self-diagnosing and self-prescribing. So with that said, let's get into a scenario. Feel free to read the STEM and then have a go at this question. How important is it to consider the patient's potential health risk from unrecognized severe hypertension? So this one is very important. If the patient's been discharged without appropriate management, then it poses a genuine clinical risk to their health. So again, hopefully we're seeing why safety is the most important thing, and how integrity can now feed into safety. Question 2, how important is it that the error had already occurred and the patient has been discharged? So this one's important. At the end of the day, this doesn't change the very action you're going to do, which is to let your consultant know about this, but it's important because it changes drastically what you can do about the situation. If they were still in the hospital, in this instance, then you could give them the hypertension management right then and there. But since they've been discharged, this might look like needing to call them to get them to follow up with a GP to get appropriate hypertension management. So it's important because it changes the scope of what you actually can do. Now, how important is the student's personal worry about negative consequences and feedback? So this one is not important at all. This is one of those examples of if you think about this factor, it might actually lead you to taking the wrong thing, which is to hide this mistake from your consultant. So that's why this is not important at all. And how important is it that there is accurate record keeping for ongoing patient care? This one's very important because correct medical records, they're essential for safe clinical decision making. A lot of this stuff often gets shared with the primary doctor for the patient as well, which is often their GP. And so having correct medical records means that everybody is aware of what the health issues for this particular patient might be. All right. And so the next standard is going to be respect. You got to respect your patients. Medicine used to be, a very long time ago, very paternalistic, meaning that it was just listen to the doctor and do as they say. In some cultures, that model still kind of exists, but in Western medicine nowadays, and certainly what the UCAT is looking for, is making sure that everything is patient-centered. And it is a discussion with the patients as to what they want, not just what the doctor thinks is right. You've got to have respect for your colleagues, your fellow doctors, nurses, and receptionists, whoever it may be. There is no room for disrespect. And respect your institution. You represent the institution that you're going to be studying in and working for. It's that old adage, when you've got school uniform on, you're still part of school. So don't do anything stupid on the bus or the train. And where this matters more is respecting the profession. Because if you become a medical professional, the public has extremely high standards of the level of behavior of the people working in this field. And so if you take actions that go against these high standards, then you're breaking the level of trust that the public has with the health system. And think about just how dangerous that could be. Think about if you're an everyday layperson and you see your general doctor being negligent and cutting corners, then you're going to think twice about seeing that particular doctor. And if that's the only particular doctor you have that's available in a 50-kilometer radius, such is the case in rural areas, then you might choose not to go to a medical clinic even when you have issues with your health. So let's go through a practice question together now. Feel free to read the stem and then we'll go through the question. How important is the impact of the consultant's behavior on the junior doctor's confidence and morale? This one's very important because this is just workplace respect, and respect goes everywhere. It doesn't matter what the hierarchy is in this instance. Because it's affecting the professional well-being of the junior doctor here, it's very important. How important is to consider whether the consultant's behavior has negatively affected patient care quality? Very important, because patient safety and care quality is the most important thing. And if there's dismissive behavior here that is affecting clinical decision-making, that's not a place that you want to be in as a junior doctor or as a patient. So it's important, very important here to deal with. How important is it that the consultant is responsible for writing the junior doctor's end of placement feedback report? Again, one of those cases where thinking about this could cause you to do the wrong thing. So this one's not important at all, because these power dynamics should not prevent addressing disrespectful behavior. And lastly, how important is it whether the behavior has been witnessed by patients and other colleagues? So this one is important because public disrespect magnifies harm to professional credibility. This was what I was talking about just earlier when it comes to the trust of the medical system. I want you to think about it from a patient's point of view. If you're a patient in the waiting room, you've just seen this big senior consultant boss doctor that is going to be treating you belittle and berate their junior doctor, then how would you feel about getting assessed by that particular consultant? That's why this is important, because it's undermining the trust that the patient has with the healthcare system. Now that brings us to professionalism. Professionalism is all about your commitment to learning. Doctors are lifelong learners. So try your best not to refuse opportunities to learn and grow. There are a lot of scenarios that come up on situational judgment about this. Think about resilience and perseverance. It's not about how many times you fall, it's about how many times you're able to get back up. There will be many a times as a medical student, as a junior doctor, and during your entire career where you will be knocked down. It's about how many times you're able to get back out of that rut. Professionalism is all about taking initiative and ownership as well, being able to engineer solutions in sticky situations instead of having to rely upon somebody else to do the dirty work for you. Now, I don't have an example on this, so I'll just talk through this now. A common one that comes up is when there might be a team member that's not quite pulling their weight. And then the question might be, how appropriate is it to escalate to a senior or a tutor and have them talk to whoever's not doing their part? And for a lot of people, they'd pick something like very appropriate to that question. But the answer to that would actually probably be B, or sometimes even C in that case, because what they would rather is have you do something about it first, try to deal with it internally, and then, and only then, if that doesn't work, then escalate to somebody else. Because you don't want to be the person that just dumps their problems on other people for them to solve. Now, another part of professionalism is working relationships. Maintain good relationships with the people that you work with. A good saying for the real world is you don't need to like them, but you do need to be able to work with. And lastly, communication. Be as clear as possible and avoid communicating between people, as messages can get muddled. Have you ever played that game where you sit around in a circle and then you whisper something into the other person's ear, and then they whisper the same thing into the other person's ear, and then that goes around in a circle until it comes back to you, and you find that the message has just been completely contorted? The reason that happens is because the more people there are in the chain of communication, the more likely that message is to be distorted. So avoid communicating between people if you can, and try to be direct and clear with your communication. All right. Let's go through a practice question here. So feel free to pause the video here and have a go at this question. So, how important is it that the surgical opportunity directly benefits her medical education and career development? This one's so important. Medical training prioritizes educational opportunities, especially these rare experiences. And for this person, if it's directly relevant to her career goals, then it's super important. It's these kind of opportunities that help build this person's professional judgment and their decision making, which ends up making them a better doctor in the future. Now, number 2, how important is it that she has already paid for the holiday and made commitments to travel with friends? This one's of minor importance. It's not something that you can completely disregard because you've obviously committed a lot to it, but these financial and social commitments, they shouldn't outweigh professional responsibilities and these significant educational opportunities. I think it's important to note as well, just this, that she's booked this holiday during term time, which gives you an important piece of context, because if this was genuinely just holiday time, there's no expectation for you to go out of your way during holiday time to do this stuff. But if it's during term time, then the expectation is to be committed to your medical learning while you're at medical school. And that brings us to our next one. How important is it that attendance demonstrates commitment to a medical training and professionalism? So this one, a bit of an obvious one, very important, because we want to be prioritizing clinical education over our leisure, especially during term time. Now, how important is it that the holiday would provide needed rest and stress relief? So this one might have been a bit of a tricky one, but the answer to this one is C, of minor importance. So well-being obviously is a very legitimate concern in medicine. Remember, safety of yourself being paramount, but one postponed holiday is unlikely to cause that level of meaningful harm. And so this consideration obviously exists because you need to take care of yourself, but it's of minor importance in this case. Again, I want to pay attention to this. It's been booked during term time. A very important consideration here, because if there was anything in this stem alluding to, it's been booked during holidays, or if there was anything in the stem saying that this medical student had a really tough time at placement and feeling quite burnt out, then this one would probably be B or maybe even A in a case like this. But because it's during term time and it doesn't say anything else about being burnt out in this particular point in time, then this one is of minor importance. And that brings us to our last standard of confidentiality, which is quite a common one when it comes to situational judgment. So when it comes to confidentiality, it needs to be maintained. Unless there is a clear exception, the information of the patient stays between you and the relevant treating team. For example, if there's a physio involved in the care of a patient, then you can share information with that physio. Not even family members can obtain information about treatment or care by asking unless authorized by the patient themselves. Another interesting thing I just learned this year is if the police come to the hospital and ask where this particular patient is, then there's no obligation from the medical team to actually give them any information, at least where I am in Victoria. So confidentiality is absolutely paramount. You don't share that information with anybody except the treating team. Now, I did say unless there is an exception. So what are those exceptions when it comes to situational judgment UCAT question? So those exceptions to be worried about is if the patient is at risk of harming themselves, again, think about safety of the patient, or if the patient is at risk of harming other people. And in both of these cases, you need to alert relevant health and law enforcement authorities. So some quite clear examples might be if there's a risk of self-harm or suicide, then you need to let the relevant authorities know that there's a risk of this. If there's a patient at risk of harming other people, it doesn't necessarily need to be overtly violent, right? It could even be that a patient has just been diagnosed with a sexually transmitted infection, and it would be best practice for them to let their partner know, especially if it's very contagious. In a case like that, if the patient is reluctant and refuses to let their partner know, then you, as a medical professional, do have an obligation to let them know, because otherwise you're putting their partner at risk. So let's go through an example of confidentiality. Feel free to pause the video here and have a go through the question. So, how appropriate is it to provide the information as she is immediate family and has a right to know? So, this has a right to know is pretty misleading. It's actually very inappropriate. Adult patients have the right to confidentiality even from their own family. There's a lot of cases that I've seen, even in the ED, where patients have voiced not to let anybody in their family know what is going on, even if they ask. So this relationship alone does not override the patient's autonomy and therefore the confidentiality of their medical information. How appropriate is it to ask the patient's permission before sharing any information with the sister? This is very appropriate. This is what happens all the time. So we just ask the patient's permission first. If they say yes, then you go for it. You can share as much information as they're okay with. How appropriate is it to share only basic information, like the location, but withhold clinical details? So this one would actually still, again, be very inappropriate. Any disclosure whatsoever without consent breaches confidentiality, regardless of how basic it seems. Even just letting them know that they're admitted into hospital can be a breach of that patient confidentiality. So, coming to our last one, how appropriate is it to suggest the sister contacts the patient directly to discuss his condition? This is very appropriate. This is what happens most of the time, where the family member will directly contact the patient to get an update on everything that's going on. Now, I quickly just want to introduce you to another question type that comes up in situational judgment. That comes up near the end. I think there's around 3 questions dedicated to this, where instead of picking A, B, C, and D, it'll ask you to rate the most appropriate action and then the least appropriate action. So you're using still the same legend or the same barometer of what's appropriate and not appropriate as you've been doing for the appropriateness questions. It's just a slightly different format. So it'll look like giving you a stem and then giving you 3 options, and then you drag and drop which one you think is the most appropriate and which one you think is the least appropriate. So pause the video now and have a go at this question. So the most appropriate thing to do in this situation is C, because this is where you can see there's a balance between safety for the patient, but also safety for yourself. When you're exhausted, when you've just come off a 12-hour shift, then putting yourself under more and more work isn't the safest thing to do for anybody. It means that you can't actually give your best assessment of the patient. So conducting an initial assessment of the patient, that's quick, that's brief, but allows you to get a snapshot view, make sure that they're safe, and then appropriately hand that over directly to the night team, allows you to have both safety of the patient, but also safety of yourself. The least appropriate thing to do here would be to just flat out refuse to assess the patient, because it leaves this patient there without care for an extended period of time. Just because your shift ends, it doesn't eliminate all responsibility when no other doctor is available. All right, so that brings us to the end of the medical principles and guidelines. And you might think, oh my days, that's a lot to remember. And it is. But at the end of the day, you don't need to remember all of this. It's not about memorization of the principles and guidelines. What I want you to do is focus on understanding why these principles are important in the field of medicine. I want you to develop these qualities in your own lifestyle. Become the person that they are testing for. Be an honest person, be an integral person, be someone that's respectful and professional. So hopefully the SAS priority ladder gives you a framework to think through these questions about. Safety and autonomy are paramount because they're the most important things. And then you look at the rest of the STEM through the standards that we've just gone through. And if you want a condensed summary of that, just click the first link in the description below, where I have every single one of my UCAT frameworks in one place. Otherwise, let's go into some common traps that people fall into when it comes to situational judgment. Number 1 is prioritizing anything else above safety. Number 2 is actions at the expense of your own well-being. And number 3 is spending too much time on situational judgment. It's important to think about, especially going into a career, but when it comes to the actual UCAT and getting into medicine and dentistry, situational judgment almost counts for nothing, unless you're doing a specific course like UQ dentistry, which at the time of recording requires situational judgment as well. I think a lot of people spend too much time on situational judgment. If you're just good enough to get above a 50th percentile, then I reckon you're in a good place. So here are your do's and don'ts. Do follow the SAS priority ladder. Do think, what would a future doctor pick? And do learn from the explanations on the official question bank, because that's your best resource to calibrate what very appropriate or appropriate but not ideal looks like, for example. Don't pick anything that compromises safety or autonomy. Don't pick options not aligned with the standards, and don't procrastinate by doing situational judgment. So with that said, here's your next steps. For the next 10 sets of situational judgment questions that you do, I want you to apply the safety, autonomy, standards, priority ladder. And if you don't already have a question platform to do these situational judgment questions on, then you can use the code Farhan for 10% off med entry.